Hi everyone. Today we are going to discuss about communicable disease. First, introduction of communicable disease. Communicable disease is one that can transmitted from one person to another and is caused by an infectious agent that is transmitted from a source or reservoir to susceptible host. And communicable disease is one in which is causative organism or pathogen is carried from one person to another and directly or indirectly. Communicable disease are also called infectious disease. Next, the types of communicable disease. It depends upon the sources. First one, respiratory infections. Then intestinal infections, arthropod-borne infections, and surface infections and sexually transmitted diseases. These are the common types of communicable diseases. Then respiratory infections are caused by germs, virus, bacteria, or other pathogenic microbes. The germs that can infect the respiratory system, lungs, throat, and airways. It can often be spread through the mucus and saliva. It is also known as respiratory secretions, expelled when a person coughs or sneezes, talks or laughs. Some of these germs are spread to droplets small enough to remain suspended and in the air and travel to over a long distance. Then, signs and symptoms of communicable disease. First one is tiredness. It feel more tiredness and loss of appetite or loss of weight. Then anemia, evening rise in temperature, cough for long time. The prevention, it included raising the resistance of the population to the diseases by good social condition and satisfactory housing and adequate diet. The BCG vaccination and after birth, the elimination of tuberculosis infection in milk by pasteurization of milk. Then the malaria, it occurs is the most topical region. Protozoa disease. The protozoa infections are the parasitic disease caused by organisms. It transmit by bite of Anthropus mosquitoes and Anopheles mosquitoes and it transmitted. The incubation period of malaria about 9 to 30 days. The mode of transmission malaria is mainly spread by vector transmission, a bite of female Anopheles mosquito, then the direct transmission by injections of infected blood or plasma, the congenital infected mother to newborn babies. Next, the signs and symptoms of malaria and is called stage. Onset of fever with chills and sensation of extreme cold. Hot stages and the temperature rise up to 106. The intense headache. Sweating stage, fever decreases with sweating. The prevention against mosquito bite is anti-larval measures, anti-adult mosquito measures. Then the surface infections are an infections of the skin that caused by bacteria, fungus, virus or parasites. The sum of the surface infections diseases are like rabies, trachoma, tetanus and leprosy. Then the acquired immunodeficiency syndromes. It means AIDS. The chronic infections which HIV and reduced immunity to others infection. The incubation period for adult is 8 to 10 years for children. Below 5 years within 2 years. The mode of transmission, it passes through the sexual contact with the infected person or through infected blood products or blood transfusion. By sharing contaminated needles or syringes infected mother to fetus, also through body fluids like semen. It also through unsterilized pricking and blights. Then the prevention method of HIV, it create awareness about HIV in one children and in children's, and it uses protective measures like condoms and the screening of all blood products, tissues or for transplant. Use sterilization methods for instrument used to pricking or nose, ear and lobes. The use of disposable single needle and syringes. Use proper protection by healthcare workers like hand gloves while handling infected patients. Then cholera. Cholera is a severe acute GIT infections. Incubation period occurs in hours to 5 days. Mode of transmission. It transmitted through food and water contaminated by flies, insects, or improper storage, and rarely with the contaminated hands of person who handle excreta, vomitus of patient, etc. Thank you.